Good morning, good afternoon, and good evening, everyone. Thank you so much for joining us today. I'm absolutely delighted to be hosting the MHPSS collaborative for this webinar on school-based MHPSS interventions in humanitarian contexts. My name is Rachel Smith, and I'm the coordinator for psychosocial support and social and emotional learning at INEE, the Interagency Network for Education in Emergencies. Just a little bit of housekeeping before we get started. If you could go to the next slide, please, Lauren. So this is a webinar, and as we're using the webinar setting, our participant audio and video is disabled. But you can post questions using the Q&A function at any time. You can also use the chat function to introduce yourself, as many of you are already doing. Tell us where you're dialing in from today, and maybe what role you do or something that interests you about this webinar. If you have some specific questions for our panelists and authors, you can use the Q&A function. Primarily, the discussion is going to focus on questions which were asked to authors during the registration. So those questions we collected in the registration form, we're going to focus on those first. If we have any additional time, we will try to get to some of your other questions in the chat. This session is being recorded and it will be uploaded to inee.org after the webinar today. We also have closed captioning available in English. If you don't automatically see it, you can enable the closed captioning by going down to the CC or closed captioning icon on your Zoom window. So thank you so much for joining us. During this webinar, the authors will present the results of the recently released Realist review on school-based MHPSS that aim to elucidate the characteristics of school-based MHPSS interventions in humanitarian contexts and the hypothesized mechanisms by which they influence well-being or learning. The question of how school-based MHPSS interventions influence children's learning and well-being outcomes in humanitarian settings is relatively new, and policy and programmatic interest is not matched yet by a rigorous evidence base, although there are some recent efforts to address these evidence gaps. With that, I'm going to hand over now to Ashley Nemiro. Ashley is the Senior Technical Advisor at the MHPSS Collaborative, and she is the Portfolio Lead for Education. Over to you, Ashley.
Thank you so much, Rachel, and thank you all for being here with us today. We're really excited to present the Realist review and hear from some exciting panelists. So thank you. And just going to briefly present on who the collaborative is and how the Realist review came to be. So we're going to be presenting research that's been conducted since 2020 by the MHPSS Collaborative and our team at that was supporting us at Johns Hopkins University, who we'll introduce later. And really this work has been comprised of two phases. So the first was really a foundational phase where we culminated in the publishing of the Realist review, which we'll present results from today. We have since then moved into a second phase of this research, which we took key learnings from the initial year to inform the planning of primary research in partnership with two implementing organizations. So the Norwegian Refugee Council and Amal Alliance. In the second half, we will present a discussion on ways in which we're seeking to form effective research practice partnerships with organizations implementing MHPSS programming. So really briefly, the MHPSS Collaborative was born out of a response to a growing body of research on the impacts of children's exposure globally to unprecedented rates of violence, abuse, exploitation, and neglect, particularly those in crisis, migration, and displacement situations. So we know that exposure to critical incidences and long-term adversity and the failure of adequate child protection leads to devastating impacts on children's physical and mental development. and their potential to actively engage in building of inclusive, peaceful societies and the socio-economic development and stabilities of communities as a whole. Next slide, please. Collaborative is a global platform for research, innovation, and learning and advocacy where we convene key stakeholders, including youth with lived experience, developing and sharing knowledge and advocating for children's mental health and psychosocial support, which you're going to hear to referred many times to MHPSS. So we focus on emerging challenges in humanitarian spaces, including MHPSS and EIE, which the Realist Review falls under that portfolio. So the project team now as it sits is myself, Jen, who I'll introduce you to in a second, Andreas, Luis, and then researchers in various locations. We have a really exciting group of advisory board members from LEGO Foundation, Porticus, NEM Foundation, INEE, Dignity, UNICEF, JRS, and War Child. Really, we are excited to present this research and then this project at large because we believe, as it says in our title, everything that we do is collaborative. And so speaking to how that played out in this project is very important to the core of who we are. So it is a great honor that I present Jennifer Flemming, and she is the lead researcher on this project. I'm going to dive into the Realist Review and the results, and then we will discuss the second phase of the research. So over to you, Jen.
Great. Thank you, Ashley. And thank you, everybody, for joining us today. So I will share some of the project origins as well, and then I'm really going to try to cover the Realist Review findings and implications before handing it back to Ashley. So for this project, the MHPSS in Action project, we sought to understand the linkages between MHPSS and SEL in school and well-being outcomes. So we wanted to focus on a strengths-based model, looking at universal preventive and promotive activities and interventions, and how they increase well-being, which we hypothesized would lead to a more positive experience in schools. So this is sort of the background of what we were thinking prior to starting the two-phase research project. Slide, please. So I'm going to talk for a bit here about the Realist Review. This is a piece of research that we conducted during phase 1 of our project. This review was led by Dr. Molly Lasater, who's also here today and will answer some questions, as well as an additional number of folks from the Johns Hopkins team, and then myself and Ashley from the collaborative. Slide, please. So for the study itself, we noted that there's certainly an increased interest in mental health and psychosocial support programming, as everyone here is well aware, in education settings to overcome the impacts of chronic adversity and loss of learning opportunities in humanitarian contexts. However, questions really remain and are still around that regarding the types of intervention for which there's evidence of impact on both MHPSS and learning outcomes for children. It's also poorly understood how these interventions work or are even hypothesized to work in order to achieve well-being and learning outcomes. And this lack of understanding, therefore, hampers efforts to adapt, contextualize, and scale these interventions. So as we sort of stated so far, the overall objective of this review was to conduct a realist review to elucidate the characteristics of school-based MHPSS interventions in humanitarian settings and the mechanisms by which they are hypothesized to influence well-being or learning outcomes. And our guiding research question was, what are the characteristics, key outcome measures, and mechanisms through which school-based MHPSS interventions in humanitarian settings work or are hypothesized to work? Slide, please. So this piece of work utilized a specific methodology, the Realist Review, as we've said. This is essentially a type of systematic review, but it's particularly suited for complex interventions. And we were setting out to learn more about the state of the field of evidence for this type of intervention. The Realist review methodology is a pretty complex process to explain in a short webinar, but it really crystallizes around a process of program theorizing, testing, and iterating. It's a multi-step process with a lot of inputs. We had a fantastic advisory board of experts that were consulted at various points throughout the process of carrying out this review. And so this slide sort of offers a snapshot of the 4 phases of the study and just very, the sort of overall idea of what we did here was that at the very start of the review, we developed 5 initial program theories. These were derived from a literature review of policy and guidance documents, and also with inputs from our advisory board of experts to sort of craft these initial program theories, which are sort of like theories of change for an intervention of what we hypothesized we might see in the literature. The second step was that we conducted a search of both academic and gray literature. Here's just sort of the overview. The articles that we included in the review focused on children ages 6 through 12. It was interventions that were conducted in a humanitarian context in a lower or middle income country. We were open to any study design. And the interventions needed to examine a universal prevention intervention in an educational setting. It was designed to be either MHPSS or social and emotional learning in nature. We ultimately extracted data from 24 final articles, and this data took the form of what is called a context mechanism outcome configuration. We'll show you some of the examples of the program theories, and that kind of helps a little bit in understanding what we mean here. But this allowed us to break down specific details of an intervention's hypothesized way of working. And then finally, the third step involved mapping these onto the initial program theories that we had developed. And then we were able to examine what was similar and dissimilar, what was present, what was missing, etc. And then the final 4th step was solidifying program theories that were informed by this process and by the context mechanism outcome configurations across all of the articles. Slide, please. So overall, and probably unsurprising to the group, there was limited evidence of positive impacts of the included interventions. We think this likely reflects issues related to assumptions underlying the interventions, theories of change, measurement and implementation challenges, and we'll discuss a little bit of that later. But some of the key components of the included interventions included psychoeducation, CBT techniques, strengthening coping skills and social support, arts, play, and music activities. In terms of outcome measures, we saw psychological symptoms of distress, most frequently measured, followed by indicators of well-being, and a few studies did include academic outcomes. And then the interventions were primarily implemented by teachers or school staff, followed by mental health professionals, community health workers, and then social workers. Slide, please. So our analysis of these 24 articles resulted in 11 program theories, and these were across these 5 levels. So 4 of these program theories were at the level of the child, 3 at the teacher level, 2 at the caregiver level, 1 at the school management administration level, and 1 at the school environment level. We actually note that I can see that this is actually a little bit of an error. We actually noted that one of our program theories related to the caregiver we eliminated, and then also the school management and administration had very little evidence of interventions targeting these levels. Slide, please. So just to give you sort of an idea of what we mean by these program theories that were developed, as I said, it's somewhat similar in terms of how we're used to hearing a theory of change explained. But this here at each of these levels, I'll kind of walk through what these program theories are so that we could just sort of understand a little bit more about what were the ways of working that were hypothesized by these interventions. So at the child level, we uncovered 4 program theories. These posit that when MHPSS prevention and promotion interventions are integrated into learning spaces, the children are better able to develop and strengthen coping skills, to understand and manage their emotions and develop greater sense of self, strengthen interpersonal relationships with peers, instructors, and caregivers, all of which then lead to improved psychosocial well-being. And then the final program theory at this level suggests that when MHPSS prevention and promotion interventions are integrated into learning spaces, then children are better able to have improved psychosocial well-being, which leads to improved learning outcomes. Slide, please. So from our review, we found 3 program theories at the teacher level. So when teachers, educators, facilitators in learning spaces actively engage in training and receive supportive supervision to increase their mental health literacy, they are better able to develop positive coping skills, which leads to improved teacher psychosocial well-being. They're better able to support their students' mental health, allowing children to strengthen self-esteem, process emotions, and develop new coping skills, which can lead to improved student psychosocial well-being. And then finally, better able to support students' mental health, which leads to improved student learning outcomes. Slide, please. We found 1 program theory at the caregiver level. This was that when caregivers are engaged in their children's learning and well-being, interpersonal and family bonds are strengthened, which leads to improved psychosocial well-being. And then we had, as we said before, had another theory developed at this level, but we didn't see evidence or interventions to support that theory, so it was ultimately eliminated from our finalist. And then we found 1 program theory at the school environment level. We said that when school environments are created to be safe, supportive, and child-centered, children will feel more secure, relaxed, and less stressed, which leads to improved psychosocial well-being and learning outcomes. And just to note that we did not have an initial program theory for this level. Rather, during data synthesis, this level emerged as a key component to many of the interventions studied. Great, slide, please. Oh, sorry, I didn't actually, I think I missed saying slide once. We'll go once more. Great. Okay, so the implications for MHPSS programming based on this research. So the first one is that there's a general statement of safe and enabling learning environments across much of the literature, but there was very little elaboration on what that meant. So our initial program theories did not include one that focused on the school environment, but as I said, it became clear during analysis that safe learning environments were central to many of the interventions studied. And while most articles in this review do note this as a foundational component of an intervention, this component is rarely further elaborated upon, explained how it is assured nor measured. So our findings indicated that while establishing a safe, secure, and enabling environment may be a priority for interventions, or even an assumption of what is necessary to begin an intervention, it was unclear if, how, or to what extent that has been accomplished, and therefore how that interacts with intervention impact. And sort of relatedly, throughout this process and also in the larger MHPSS literature and in conversations in our sector, there's much attention currently given to the shift towards more holistic, whole child and whole school approaches to MHPSS programming, as opposed to the single component interventions. And this approach emphasizes the many levels of actors, school leadership, teachers, staff, caregivers, communities that are critical to embed a safe and inclusive learning environment for children. Thus, these sorts of interventions are typically multi-component and work with a broader range of partnership with caregivers and the wider community in addition to the school. And so we see a bunch of evidence related to this whole child and whole school approaches in high income countries. But as we've said before, the majority of interventions in this review were single component interventions. And we know that there's sort of a lot of likely reasons for this, including the relative youth of the evidence base broadly, as well as the complicated nature of conducting rigorous impact research in dynamic contexts. Still, we're just noting that it's critical to move towards this more holistic picture of MHPSS programming that is embedded in larger school, community, and then also policy environments. Slide, please. So there were also notable implications in our findings for efforts to build the evidence base. And a key finding of the Realist review was in regard to the selection of outcome measures. And as has been observed in other reviews of MHPSS literature, many interventions are evaluated using numerous outcomes and often with limited theoretical justification for the use of those outcomes. A clear rationale, including a stated theory of change, is needed regarding which outcomes are selected for evaluation and why. Also consistent with sort of other writing in the past, some of the most commonly measured outcomes in this review were clinical symptoms of psychological distress, and these, we note, are inconsistent with a psychosocial framework. So related to that, measurement of non-distress outcomes, including things like social connectedness, coping, subjective well-being, are critical as they often better align with the underlying frameworks of psychosocial interventions. And overall, we note that building the evidence base of what works, for whom and how is a very long-term endeavor. We're at the beginning phases of building this evidence database. Our work with our advisory board and consultations with experts in this field simply really underlines this fact. And the Realist review itself also, notably emphasized this. Slide. So I am now going to hand it back over to Ashley, who's going to do a brief walkthrough of how we're taking this learning to move into a next step of a research project, and then we will continue on with discussion. So thank you. You're muted, Ashley.
I swore I'd hit the unmute button. Thank you so much, Jen, for presenting the results. And as you saw in the chat, we posted the Realist review, so you can go and look at these program theories in detail and hopefully utilize them in your work. So to really add to the evidence base in the second phase of this research that's supported by Porticus, we're really looking at how we can move forward using the socio-ecological framework to better understand aspects of enabling environments for MHPSS interventions in school-based settings. So with this second phase of research, we really want to contribute to the evidence base more broadly and take note of expert feedback we received, which really emphasized the need to build this strong base of understanding. So in the second phase, the research project is called Examining Enabling Environments for MHPSS Programming, and really looking at the perceptions of children, teachers, and caregivers across different contexts. It's important to note, and Jen was talking about this, that we want to look at all these different levels because we feel it's extremely important to look at the enabling factors, not only with teachers themselves, but also children, caregivers, and the wider community. So it's important to note that while we were in the first phase of this project and while conducting the Realist review, that experts really emphasize how young this evidence base is, and we're still really learning about the fundamentals. What I love about the Realist review methodology is we look at what works for whom, why it works. And so this second phase of research is really trying to dig deeper into that. And really conducting the Realist review helped us to reflect on some of the more foundational components of interventions within education spaces and how we can craft research that helps to build deeper understanding of these foundations. Noting how context-specific MHPSS and social emotional learning programming is, we want to use qualitative approaches to try to get deeper into some of these contextual differences. And finally, we want to build a proposal that left a ton of room for co-designing with our partners. So I will present some of the research questions, but really we sought out to find partners and then take some of these research questions and really determine what our partners also wanted to know about MHPSS programming in education, looking at those different layers. So at the child level, the teacher level, and the caregiver level. Next slide, please. So these are our primary research questions. And as I said, we're going to be working with our partners to really dive deeper into some of the developing co-research questions. So I'll briefly go through these. What do children's teachers and caregivers perceive to be the role of classroom-based MHPSS interventions in humanitarian contexts? What are students, teachers, and caregivers' perspective on what constitutes an enabling environment for MHPSS interventions in education in humanitarian contexts? And what are the key elements of different domains of an enabling environment as assessed across different contexts, and how do they relate to each other? What roles do classroom-based MHPSS interventions play in return or re-entry to school during COVID-19 closures in humanitarian contexts, or during closures due to other crises, such as we're seeing in the Ukrainian response? What is the perspective of implementing staff, local stakeholders, and other relevant actors regarding change processes within a specific MHPSS intervention? Next slide, please. So we're really excited to be partnering with NRC teams in Kenya and Colombia in order to study their Better Learning program, which I'm sure many of you are familiar with, and we're going to learn more in a second. And also Amal Alliance, which is an organization that works across a network of small NGOs in 9 sites in Greece, and we'll be studying their Colors of Kindness SEL program. We're currently in the inception phase of this research, and we will be starting data collection, hopefully by the end of summer. And really, it's important to note that we want this research, just like what came out of the Realist review. We really hope that it serves as to build the evidence base for all MHPSS in education and emergency practitioners to really support the learning around what works, how do we integrate MHPSS into education settings, what works for whom, why it works, and really looking at those different levels. So what works for children, what works for teachers, and also caregivers. How are they involved in promoting the mental health and well-being of children within the school setting? We're really excited about contributing to the global evidence base and really continuing to add to this movement around holistic learning outcomes within education spaces. Slide, please. So as I mentioned, one of the sites that we'll be conducting research at is in Kenya, in Kakuma. And I'm really thrilled that Jackline Oduor, who is the education officer at NRC, is able to join us today to discuss the MHPSS in action in education research. One of the interventions actually that we reviewed in the Realist review was the Better Learning program. And Jackline will tell you more, but the Better Learning program seeks to improve learning conditions for children and adolescents who are exposed to war and conflict through the integration of psychosocial support, psychoeducation, and coping techniques into daily learning. So I will be asking Jackline a few questions, really around what BLP is, the mechanisms, the theories of change around BLP, and how it supports students, but then also how it works with teachers and caregivers. So Jackline, really excited to have you here with us, and I will jump in. So Yes. So Jackline, where is NRC rolling BLP out in Kenya, and how has it been integrated into the school system there thus far?
All right. Thank you very much, Ashley. Probably just before I answer your question, to give a sneak peek of what BLP is all about, Better Learning Program. This is a classroom-based PSS intervention that is meant for children who are actually in crisis-affected communities, and it supports their recovery from traumatic experiences. So under Better Learning Program, we have got three categories: Better Learning Program 1, Better Learning Program 2, and Better Learning Program 3. Better Learning Program 1, the one that we currently are implementing in Kenya, is all about reaching out to the large group of learners, and it is about enhancing their resilience and well-being within the classroom. So in Kenya currently, we started off implementation of BLP in Kakuma, Kenya, and we're looking forward to expanding also in the DAB and reaching out to the masses just to be able to change to enhance wellness of learners in every setting that has got emergencies. Yeah.
Great, thank you so much, Jackline. And the next question for you, and this is something that I often will ask people and often wonder, but we hear the term psychosocial support. That psychosocial support is integrated into education. We have psychosocial support programming. And when you say that within BLP, what does that actually mean? Can you give us some examples of activities, psychosocial support activities, that are used within the Better Learning Program to promote mental health and well-being? All
right. For any psychosocial, program to be effective, there needs to be a very strong element, of support, and that is a social support. And that is a key item as far as implementation of Better Learning Program is concerned. So Better Learning Program is actually anchored on what we call the recovery box, or the principles of recovery. So one of the principles is that it is about guiding the child to be able to calm down. So traumatic experiences and stresses, usually sometimes, it happens that once a child is exposed to a lot of traumatic experiences, sometimes that alarm, is never switched off in their mind. And these alarms go off and on at any given time, be it in the classroom or even back at home, wherever they are. So the Better Learning Program is equipping the child with the skills and knowledge to be able to calm down, especially when that alarm goes off. And, just be able to confirm to themselves that, yes, I was in a situation that was traumatic, but that experience is no longer in existence. So I need to be able to calm down. The other principle is based on a sense of stability and safety. And this is where we're bringing in the school, because based on the fact that the school has got a routine, it usually promotes quick recovery. So with the schools having the different, the routines, that the child is able to adapt to, it promotes a sense of safety and security. So with this child being in school, then they're able to realize that there is some element of stability and safety around me. It also empowers the child that I have the power to change my situation, the self-efficacy bit of it, so that the child is able to understand that he or she has the power to change how they feel at any one given time. So it is a journey that gives them that power to believe in themselves and get to know that I am able to change how I'm feeling at any given time, especially in response to traumatic and stressful situations. It is also embedded, but the other principle is embedded on connecting with others, because with the PSS, the social construct plays a very, very big role in the well-being of the child. And so looking at the school setup, we have got the peers and we have got the teachers. And these are actually very, very supportive in terms of enhancing the well-being of the learners. So as a child is interacting within the school and without the school, it helps grow the particular social construct of this particular child, and that enhances the well-being. And then finally, last but not least, of course, Better Learning Program is geared towards, helping the child to reestablish, hope for the future. And after all is said and done, what one can really look forward to or have is hope, yeah? And the Better Learning program is about helping the child to be able to have hope that no matter what is going on right now, then there is something good in the future. So all these are coupled with also getting the learners to understand what are some of the things that stresses me as a learner, wherever I am? Am I able to identify the things that are traumatic and stressful? How does my body, how do I respond to it? How do my friends respond to the different traumatic and stressful situations? And then what am I able to do to be able to calm down and continue with my learning so that it promotes that resilience? So it is coupled with a number of breathing and calming activities apart from the different knowledge that they get. And so they do the different breathing and calming activities that are incorporated not just within the classroom lessons, but also in the various school activities. So we have got Better Learning program incorporated in every lesson. And then the different school activities, like within the assembly, when they come in the morning, they perform those particular activities, and that helps them to start off the day even on a calm note. So that is how the PSS or Better Learning program is actually entailed within, we incorporated within Kakuma and the entire school settings that offer Better Learning program. Yeah.
Thank you so much for that. And my next question is around strengthening both home and school environments. So Jen actually spoke about these theories of change that were developed as part of the Realist review. And we all know anecdotally how important strengthening home and school environments are, and also by involving caregivers and teachers to identify and respond to children who might be showing signs of distress. So can you tell us about how BLP works with both school systems and caregivers to support the well-being of children?
Okay. So currently in Kakuma, we're working very closely with the teachers who are teaching within the Kakuma setting and also the parents. So how then does BLP come in? So first of all, we ensure that the classrooms have established routines. We work with the teachers to ensure that classrooms have established routines that help to build a sense of, this is done in such a way that the children expect working with a certain routine whenever they go to school, and that actually gives them the sense of satisfaction that yes, the school is actually safe for me. Better Learning program also does the training for teachers in establishing recovery principles. Remember the recovery principles that I talked about initially? So the teachers that we work with are actually trained on Better Learning program. And Better Learning program, is not just implemented by anyone. It is implemented by someone who has been trained on Better Learning program. And we have got guidelines that, indicate how it's supposed to be trained. So the teachers are trained on the recovery principles and how they're able to create that recovery box within the school that will be able to enhance the recovery of the learners. Not forgetting, of course, using child-friendly communication, because within the school setting, there's so many things that go on. Besides, just having the learners go through the Better Learning program, there is that interaction between the teachers, the learners and the peers, which needs to be defined in such a way that the child will be able to feel safe. So how then does the teacher communicate to the learner that enhances a sense of, safety? How is this child disciplined? What sort of discipline is given to this particular child that will be able to make the child feel that yes, the school is a safe space for me. So all these coupled with the training that the teachers receive, then it promotes that sense of safety within the school environment. BLP also ensures children have social connections, that is through teachers and peers. And this is actually done within the various school activities, ensure that the children have got the physical education where they're able to interact, the various group activities, and just enhancing that teacher-learner relationship, the teacher making it so easy for the learners to be able to approach them and be able to discuss a few issues, and also the particular forums like the peer-to-peer, that enhances the relationship between the learners and the learners themselves. So the social connections are actually promoted by the teacher, so that even as the teacher teaches in class, then they are actually going an extra mile of just helping the child to be able to build relationships. That particular child who probably for one reason or the other is so quiet in class, so withdrawn, the teacher is not just going to keep quiet and look at the child doing nothing and they feel so left out. Yeah, so they go out of their way to be able to help the learners to be able to interact. We've also engaged caregivers, the parents. Yeah, and currently we are actually doing parental awareness on better learning program, and because one of the things that is actually very, very common is the fact that the parents themselves are actually undergoing trauma. They've experienced traumatic and stressful situations. And many a times you find it's very difficult for them to be able to bond with their children or even follow up things to do with school activities. And so creating this awareness within the parental group to help them understand that just like them, children also get stressed. I remember initially they were like, children don't get stressed because they don't look for money. Yeah, but later on with the awareness, they were able to realize that the children get stressed. They've been able to see the different signs, that show that their children are stressed. And so what we empower them to do, how to incorporate those particular activities within the homes and be able to give feedback and get to see, because that time that they're doing the activities, they do it together. And that promotes the bonding. And the child is able to open up even further to the parents based on the frequency and how close that interaction is. So we're establishing what is called a tripartite relationship, where the learners would feel free to interact with their parents, they feel free to interact with their teachers, and so there's also an interaction between the learner, the school, and also the parent. And then last but not least, it is geared towards establishing mechanisms to ensure, to ensure well-being of teachers and facilitators. Education in emergencies come with a lot of challenges. And that even as we focus on the learners, the teachers themselves experience very stressful situations that are arising even from the profession in itself. And so we are geared towards, enhancing not just the well-being of the learners, but also the well-being of the teachers. And the Better Learning Program does that through what we call supporting the supporters program. Yeah, so using the Supporting the Supporters program, we actually work with the teachers to enhance the well-being even as they help the learners. Because as they say, you can never pour from an empty cup. You've got to fill the cup. Yeah, thank you.
Thank you so much, Jacqueline. That's really informative. And one last question for you, and this is something I know Jen and I talk about a lot, and we're really hoping to gather more data around, is when you and NRC went to implement BLP into the education system, specifically in Kenya and Kakuma, was there any pushback from teachers and educators? And really, how did you manage this pushback?
Okay. Thank you. Yes, there was a pushback, and the pushback was pegged on the fact that apart from the challenges that they're already experiencing of handling large classes and the workload, they saw it as another workload on top of what they were meant to do. But with the full understanding of how BLP would actually help the learners and in turn also make it easy for them, they were able to pick it up, because you're looking at one, when the learners are exposed to Better Learning Program, there is an element of improved relationship amongst the learners themselves. And that is one thing, that is very, very key, especially in emergency setting, where we have got a cocktail of so many, citizens. Like in Kakuma, we have got the refugees from different settings, and you know, having had a background of the war and the fighting, you know, there's that need to be able to bring them together, the cohesiveness, all right? And so better learning program actually help the learners to be able to better their relationship with one another. And so even, for instance, episodes of fighting in school that was initially a problem to the teachers was actually dying down. Now, that is coupled with improved behavior and ability to resolve conflict. So the fact that we're able to see a general improvement on the behavior of the learners, both within and without the class, they got to realize this is actually making it easier for us to be able to teach even when the learners are in class. And then, of course, the learners were able to develop more confidence because you see already there's the ease of relationship between the teacher and the learner. So they're able to speak out, they're able to relate well with the teachers. And so we're looking at a situation where the confidence of the learners is actually enhanced. And then the cap of it all is improved concentration, because once the learner was able to calm down and be able to regulate themselves and realize that, you know, the school is a safe place and there's nothing that is supposed to stress me, I have control over how I'm feeling, then you realize that all these are actually working towards enhancing teaching and learning process, which was actually, you know, well taken in by the teachers. Thank you.
Thank you so much, Jackline. And I think just one quick follow-up to that is, so it from what you're saying is, of course, anecdotally, there's really positive effects. And I know BLP's actually, research has been conducted in other settings, but from what you've seen in Kakuma, what are some of the things that teachers have actually said? Maybe those teachers who were reluctant to adopt better learning program because it was a higher workload, it was, you know, more put on them. From your experience, what have some teachers said about how it's actually supported them and their students to learn?
Actually, there's a lot of positivity coming from the field, and the reason being that the fact that even the teachers are able to use better learning program activities within the classes to break the monotony and to just get the attention of the learners, it has made the you know, the learning sessions be very, very interesting, and they're glad that slowly by slowly the learners are catching up even in terms of their learning. So there's very positive feedback that is coming up based on now the ease at which they're able to manage the children compared to before. One thing about classes in Kakuma, they're very, very large. You would find a class, for instance, having over 150 learners in a class. And that can be very, very difficult if a teacher, it can really be very overwhelming on a teacher. So using this particular better learning program activities within the class, because they're very, very interesting and the learners enjoy them, you know. Every time you go to class and they're like, we need to do some breathing, calming activities, they're like, yeah, all right. So it captures their attention and they're able to calm down. And right now we are even seeing a situation where now there is that peer-to-peer kind of interaction where they have got their various clubs where they teach each other on how to be able to calm down even in the absence of the teacher. So those are good reports that you're getting from the field. Yeah.
Great. Thank you so much, Jackline. We really appreciate you being here and speaking to us about your experience and the Better Learning Program. I am now going to introduce Molly Lasater, and Molly was the lead author on the Realist review, and Molly is an associate at Johns Hopkins Bloomberg School of Public Health, and was very excited to have her here with us, and she's going to answer some of the questions that you all posed when you signed up for the webinar. And I will actually hand over now back to Rachel, who's going to be asking the questions to the authors.
Great, thanks so much, Ashley, and thank you all for your time. This has been absolutely fascinating. A question for Molly then. I think we want to get really concrete here. What was a key element for effective MHPSS in schools programming that you saw?
Yes, hi everyone. Thanks for joining in. So first, I just want to reiterate the goal of a realist review is to elucidate mechanisms that are underlying the interventions. So we didn't really dive in to the extent to which interventions were effective in addressing well-being and learning outcomes, but we were able to really examine what are the hypothesized mechanisms or key elements that are in these interventions that are leading to well-being and learning outcomes. And these program theories map onto the different socio-ecological levels. And across some of these levels, we see some commonalities, including the building of coping skills. We saw this at the child level, as well as at the teacher level. We also saw strengthening interpersonal relationships at the child level, as well as at the teacher level, or sorry, at the caregiver level. Other key elements that we saw, so at the child level, in addition to building coping skills, bolstering emotional regulation skills was also a key element. And together, coping skills, emotional regulation, strengthening interpersonal relationships, these are all hypothesized then to contribute to improved psychosocial well-being, which together are also hypothesized to lead to improved learning outcomes. At the teacher level, we were able to see, again, how coping skills and the provision of support was instrumental in improving psychosocial well-being. And then, again, seeing a linkage from improved psychosocial well-being in the students was then linked to improved learning outcomes. Then at the caregiver level, we see that strengthening interpersonal relationships and family bonds triggers improved psychosocial well-being, which then, in theory, would then lead to improved learning outcomes. And then lastly, at this level of the school environment, we saw how fostering feelings of safety and security and calm is linked to both psychosocial well-being and improved learning outcomes. Now, while we did find limited evidence of the positive impacts of these mechanisms or key elements at these different levels, this may in fact, reflect some issues related to core assumptions, as Jen mentioned earlier, related to the theories of change underlying these interventions, as well as some measurement issues. For example, what we're choosing to measure, are distress outcomes the most appropriate measures when we're looking at improving psychosocial well-being? Other outcomes, such as social connectedness, hope, these might be more appropriate. As well, there are numerous implementation challenges working in a EIE setting that could limit our ability to detect positive impacts.
Great, thank you so much, Molly. Thanks for clarifying that as well. And it's also great to hear, that teacher well-being comes up within these positive theories of change and within programming. My next question is for Jen. Jen, how can we influence the policymakers to integrate MHPSS to the school curriculum?
Thank you. So thank you for this question. I sort of acknowledge that it's a big question. And I think I would start off by noting that our review centered mainly on impact at the level of intervention. So moving beyond that towards policy, adoption of MHPSS frameworks into curriculum, et cetera, I think goes well beyond this. But that being said, there are a lot of key learnings from our project to date that I think I would point out are really relevant to this question and to answering this question moving forward. So first off, during phase one of our project, the development of both this realist review and then also proposed primary research moving forward, we consulted, as I said, with an extensive roster of experts experts, folks in research, implementation, advocacy, different fields, and across different levels of ecosystem, and also folks with MHPSS backgrounds, education, protection backgrounds, so a wide variety of folks in terms of the diversity of where they're coming from and where they sit within the ecosystem. So in terms of research, researchers across the board really emphasized how young this evidence base is. And I know that this is something that we say a lot and probably hear a lot, but this is definitely something that we can point to in the review and that we've tried to emphasize in the review and in any presentation about this. For the education and emergency sector, I think it's easy to say that we've been talking about MHPSS and PSS-SEL for what seems like a long time now, but developing, implementing, and disseminating or publishing research is just a deeply time-consuming activity. And the foundations of this research and evidence base are truly just being built now. And I would point to, the field of social emotional learning research that has been happening in other contexts, in high income contexts elsewhere in the world, and note that social emotional learning has something that has been studied, and that evidence base has been being built over like the last 25 or so years. So we're still at a very early stage in terms of building that evidence base for emergency settings specifically. And that being said, there's researchers within this space have learned a lot to date that I do think are particularly relevant in terms of influencing policy. And one is a sort of probably a pretty obvious one, but prioritizing the strategic sharing and dissemination of research findings is extremely important. And this is certainly extremely important, not just at the global, but also more localized or regional levels. And I think that in this regard, there's opportunity for different types of actors, donors, et cetera, to influence this. For example, the donor for our research, Porticus, has required an extensive dissemination period that prioritizes knowledge sharing and also prioritizes that across various levels of the education and emergencies ecosystem. So built into our project is a lot of emphasis on that sharing of information and sharing of learning, noting that an academic article such as our article here can take years to be published, and that there needs to be mechanisms for sharing probably prior to that. And then this also has implications for the data itself, and the fact that often program evaluations are internal, which means that there's a tremendous amount of organizational learning and knowledge that has already occurred and already exists in regard to MHPSS programming. And I would note that in our Realist review, for example, of the 24 articles that we included, only one of them was a program evaluation, and that was for NRC's Better Learning Program, and this was publicly available. We only included documentation that was publicly available. And then the second point I would speak to in terms of, I guess it's still in terms of evidence building, but evidence building towards influencing policy. It relates to one of our key findings of the Realist review, and that is, as I think Molly was just talking about, the strategic selection of indicators and measurements and measurement tools for MHPSS and well-being related outcomes. So, what we've said a few times here, but what we saw in the Realist review and across other MHPSS literature to date is that many interventions are studied or evaluated using numerous outcomes, but without justification or rationale offered for why they were using these outcomes. And that a clearer rationale and a clearly developed and potentially iterated theory of change for an intervention is really, really critical in order to select the relevant appropriate outcomes. And also, this also includes recognizing that PSS and SEL frameworks will not necessarily be compatible with some of the more traditional psychological distress outcomes that we're seeing. And related to that as well, it's just to note that there's a lot of work being done in this regard, and much of which is facilitated by INE and its membership base. And this of course includes the measurement library, which is a place that you can go to where there are a vast number of tools that can be used, many of which are PSS SEL. And then also, you know, the fact that the development of the social emotional learning framework toolkit that's currently being undertaken, I think that again, that emphasizes frameworks and guidance that is context specific, and that will move towards the idea of being able to ultimately integrate these frameworks into policy tangential discussions.
Great, thanks so much, Jen. And yeah, I admit that was a big question for you to tackle, but I really appreciate the focus on evidence, and also, as you were saying, you know, being able to share evidence in a timely manner, or share interventions that are ongoing, which kind of leads me to promoting a little bit the INE community of practice. When we talk about sharing and community building, we have, some of you are probably already members, but you can join for free on Slack, and we have a channel on MHPSS and SEL. So it's a great place for you to, of course, you know, promote published things, but also to discuss, you know, discuss things in process and in progress. We don't have to be so perfectionist before we kind of share early findings and things like that. And I think this is a great, slightly more informal forum for people to do that. So just drop that in the chat if you haven't signed up. Please go ahead and do so. We'd love to see you there. Just being mindful of everyone's time. One last question then for Ashley. So Ashley, what role does supporting teachers and parents play in school-based mental health support?
Thank you so much, Rachel. And this is a really important question, very similar to Molly and Jen's question, not easy to answer in a short time frame. So what I'm going to do is really answer this grounded in the Realist review findings. So when developing program theories, as Jen mentioned, there were 3 specific theories that focused on teachers and 2 related to caregivers. So the teacher program theories were really related to receiving training and supervision to increase mental health literacy. So increase knowledge, skills, attitude around mental health and well-being for students. There was also a focus, of course, on teachers' own well-being and mental health and how those skills can transfer to students. We all know that teachers have an incredibly important role to play in promoting positive mental health at schools. They also have a really important role to play in supporting children who are in distress, creating emotionally safe learning environments, and knowing when and how to support children to access care if needed. Knowing it's important and actually ensuring that that happens are 2 completely different things. And I think, as Jen and both Molly mentioned, you know, there are a lot of barriers that we hypothesized as to why there hadn't been research conducted, but also why there weren't program theories, evidence to promote these program theories. So it doesn't necessarily mean that it's not happening. And so I want to highlight that. But through this Realist review, we don't necessarily understand what works and why it works in terms of teachers and caregivers' involvement in promoting school mental health, because the evidence was quite limited. So I'll go in briefly to the caregivers program theories were really built around engaging children's learning and well-being. As I said, there was little evidence extracted to determine what worked and for whom. So specifically evidence linked to caregivers engaging in children's learning and well-being to help foster positive relationships among their children with learning spaces. Again, doesn't mean it's not happening by any means, and doesn't mean that there aren't some great theories of change and programming that's happening in humanitarian settings, just that we didn't find research around it. So Jen mentioned this a little bit, and I want to highlight it again, that one framework that we reviewed was on whole school approaches, which is a multi-component intervention that involves all parts of the school. So it's looking at administrators, teachers, staff, working in partnership, which is so important with caregivers and the wider community, to really look at how do we improve student learning and well-being. So the theory of change underlying whole school approach interventions suggests that broadly through active, collective, and collaborative action to address the needs of all members of the school system. So not just the students, but teachers, school staff, caregivers within school curriculum and across the school environment, that children really, if you address all these different levels and there's a whole school approach, that there's interventions that are not just at a singular level, that it has really can be extremely impactful. As Jen said, you know, there's a lot of evidence in high income countries, but we don't necessarily have this evidence yet in humanitarian context. And so while we know that teachers and caregivers' own well-being and mental health is incredibly important, and education and emergency practitioners have really advocated, I think there's been this huge push to move away from traditional education systems to more holistic learning methods in humanitarian settings, as we know that teachers and caregivers play such an important role in really supporting children with chronic adversity, loss of learning opportunities. But as I mentioned, however, within this review, the research we found was incredibly limited. And I think that's why it's fantastic that there's a second phase of this research, because we really are hoping to understand, you know, what are those different components to teachers and caregivers supporting the well-being of students within an education setting. So thank you so much for that question. And again, I think some of these questions and some of these issues, the Slack space that Rachel mentioned, are just a great space to continue having conversations like this, getting inputs from other practitioners who have the same exact questions as are coming up here in the chat. So I personally am on there and I love it. I go there all the time for just for support. Great, thanks so much, Rachel.
Thank you, Ashley. And just yeah, just to say, you know, we received a lot of really fantastic questions in the chat, and what we'll do is try to answer those offline and then send some responses to you after the fact when we share the recording of this webinar. It just goes to show, you know, how many people signed up for this webinar and how many of you attended, what an incredibly important topic this is, but also kind of underlined by the fact that there isn't a great deal of evidence currently. So just taking on board the messages shared by Molly and Jen and Ashley and Jackline today. So thank you all so much to our panelists, the authors, for your time today, and thank you to all of you for attending. We will share the webinar recording with you on our website. As I mentioned before, we'd love to see you join the community of practice, and we will see you shortly on a webinar sometime in the future. We've got lots of events coming up, so do check the INEE events page. Thank you all so much.
Thank you so much, everyone. Thanks, Rachel, Jackline, Molly, and Jen. And you as well, Lauren.